Haba Jubab ya jingkali beningkong haka kenta kali jingkali haka sengi balai jongga dorbar senrai jongga ying dorbar thawan ke jela Meghalaya haka sipautare unai luar arhaja arpusan ke Dr. Mazel Amprin Lingdo ke Myntri bedikmi yakatanat kokot kakia jongga sarkar jela kala pentip baki bangat Jingpang Japanese Encephalitis ha Meghalaya haus nam arhaja arpulai arhaja arpusau ki don prapu kandai ngut bad haus nam arhaja arpusau arhaja arpusan ki don shispa saupo nyongut Kamiani di Shira MLA ke All India Trinamool Congress na ampati kalakali benrap ru halor ke jingdan ki baklat na kani ke Jingpang hakaba ke Dr. Mazel Amprin Lingdo kala Jubab bagi dan Khatphra Ngut barok hakini ki Snem. Kani ke Jingpang kedai ke balapin sa priang da upper jong yau kenyang Jingpang Japanese Encephalitis virus na ki merat ki jingri bat ki sim syaki brio hakaba lak ban keta ya ke jabing. Ka Myntri halor kisin jam bak sarkar jala kala shim bante lakam ya kani Jingpang kala ong balapan long ya ki program I inject hakeleng ki jaka nalor ka jingsam ya ki tiar yada kiwai pat ki bala bu jingkali halor kani ka phang ki kentup yo MLA ka All India Trinamool Congress na Raja Bala u Dr. Mizanur Rahman Kazi uba Arden Mela Basayo Moj MLA ka Voice of the People Party na Nongkrem uba Adelbert Nongrum MLA ka VPP na North Shillong uba Havingstone Kharpran MLA ka VPP na Mauringkneng.
The question hour, let us take up the question number 36, raised by Srimati Miani Dishira, MLA. Minister in charge to reply, please.
Honorable Speaker, sir. Reply to start question 36, sir. A. So the number of JE or Japanese encephalitis cases detected is 89 numbers in 2023-24. And 147 numbers in 24-25. The district-wise number of JE cases detected in the state of Meghalaya: East Khasi Hills 23-24, 10, West Khasi Hills 5, West Jangte Hills 34, Ribhoi District 25, West East South Kyrwoh Hills 0, Southwest Khasi Hills 5, East Jangte Hills 5, Southwest Kyrwoh Hills 2, North Kyrwoh Hills 0, East West Khasi Hills 3. In the year April to March 24-25, East Khasi Hills 29, West Khasi Hills 5, West Jangte Hills 49, Ribhoi District 25, West Kyrwoh Hills and East Kyrwoh Hills 0, South Kyrwoh Hills 1, Southwest Khasi Hills 1, East Jangte Hills 22, Southwest Kyrwoh Hills 2, North Kyrwoh Hills 0, Eastern West Khasi Hills 10. Sir, B. Steps are taken by the government to fight the disease as per statement placed on the table of the House, sir.
You may seek your...
Thank you, Mr. Speaker, sir. I want to thank the Honourable Minister for the reply. Mr. Speaker, sir, may I know from the Honourable Minister the number of confirmed deaths due to JE in the past 2 years?
Honourable Speaker, sir, district-wise number of JE death cases. April to December 23, nil. JE death cases April to December 24, 15. JE death cases April to December 25, 3.
Mr. Speaker, sir, we can see from the reply of the Honourable Minister that the cases has been increasing every year, and the death is also quite a number. So therefore, sir, may I know from the Honourable Minister whether the government is planning to have a vaccination drive for senior citizens and encourage young adults to get themselves vaccinated, because I can see from the Honourable Minister's reply in point B that vaccination with the routine immunization program is being done. So for the senior citizens and for the young adults, whether the government is planning to have a vaccination drive.
Honorable Speaker, sir, this vaccine, sir, was introduced as the Universal Immunization Program by Government of India in 2015. Status of coverage of immunization. In eastern West Khasi Hills, it's at 79%. East Garo Hills, it's at 80%. East Jaintia Hills, it's at 98%. East Khasi Hills, it's at 71%. North Garo Hills, it's at 84%. Ribhoi, it's at 82%. South Garo Hills, it's at 92%. Southwest Garo Hills, it's at 93%. Southwest Khasi Hills, it's at 74%. West Garo Hills, it's at 95%. West Jaintia Hills, it's at 90%. West Khasi Hills, it's at 77%. This is inclusive of the first dose as well as the second dose of the vaccine. If you notice, though I have just read it aloud, the percentages where incidences of JE is higher, there has been an extensive, widespread awareness. Hence, you see that percentages of coverage of vaccination is much higher as compared to areas where incidence is nil or not a threat.
Mr. Speaker, sir, actually, I wanted to know from the Honourable Minister vaccination drive for senior citizens and young adults.
Sir, the actual JE vaccine is part of the Universal Immunization Program for 9 to 11 months and 16 to 23 months. Now, when we look at the age groups of JE occurrence, we do notice that the largest number is for infants. And because this program was only introduced in 2015, wherever there is high prevalence of mosquito, we recommend for universal coverage.
Mr. Speaker, sir, we know that in our neighbouring state Assam, there are very high number of cases for JE, and the number of confirmed deaths due to JE is also very high. Therefore, sir, I thank the Honourable Minister. We have a very high coverage of vaccination in almost all the districts. And as we all know, the most vulnerable to the diseases are infants and senior citizens. But for the infants, as we all know, it is being covered under the universal immunization. However, I'd just like to make a suggestion to the Honourable Minister that within the community, I think the information about this disease is quite low. And when patients having symptoms of JE are reported, because the initial symptom is just fever, and then only later on the hallucinations and the other symptoms tend to show. So within the community, there is lack of awareness. So whether the government is planning to have awareness programs for the citizens.
Honourable Speaker, like every virus, community awareness and IEC activities have proven to be very, very successful. And yes, intersectoral meetings between different departments, different districts are already being mobilized, especially in the high vulnerable areas. We are also now, sir, in the process of sensitizing even officials of the veterinary department, because there we have seen that veterinary officials also have to understand and be a part of the entomological surveillance and vector control. There has to be this coordination. Ashas now, sir, are also going to be included in this awareness creation. And in fact, we are scheduling the Asha program this month or the coming month so that we can involve them, sir. Sir, one of the greatest challenges for the rise in JE obviously is climatic change. So we are on the job, sir, and there is a very targeted intervention by the government of Meghalaya to ensure that even under climate change, we have components of interventions which are going to be effective overall.
Your last question.
Sir, last question. Mr. Speaker, sir, may I know, not a question really, but a suggestion rather, that if the government can advise the medical fraternity to be on high alert, because this disease is spreading very rapidly, unexpectedly. We can see that in all the districts it's increasing, and in few of the districts we can see the cases are nil, but I'm sure it's not nil. So if the medical fraternity can be on high alert to test this and be on the lookout for the symptoms of this disease. So this is my humble submission. Thank you, sir.
Point noted, sir.
Thank you. Dr. Mizanur Khaji, please. You can press the request button for.
In course of a reply, Honorable Minister, I could see that in certain districts like West Garo Hills, it's a large district wherein the cases are 2023 and 23-24, 24-25, it is nil. So, and as we all know, that the diagnosis of Japanese encephalitis itself is a very complex process. So I just want to know from the Honorable Minister that whether adequate training and adequate expertise programs are being given to the doctors to diagnose the disease in the initial stages and to confirm the diagnosis.
Honorable Speaker, sir, this dreaded disease is a disease which is being taken very seriously by the government. In fact, the NVBDCP, which is a Government of India SOP, the initial SOP, the constitution of this surveillance is already on the job. We have what we call the designated sentinel labs. Maybe, sir, department now is reviewing whether or not these designated sentinel labs should also be in every district. We are working on it. And as correctly indicated by the member himself, a doctor, there is a requirement of manpower. Most important in this surveillance is what we need is the microbiologists. And yes, the department is aware. And we are now looking at a possibility, sir, of actually sponsoring candidates in areas where there is lack of manpower so that we can combat and have the necessary interventions to ensure the safety of citizens at large?
Mr. Speaker, sir, actually what I intended to say is, yes, laboratory is one aspect, then training of the medical officers who are responsible for the initial diagnosis to pick up the symptoms of the disease. So I think that is very important because the diagnosis of Japanese encephalitis itself is a very complex process. It mimics like many other simple fever, flu like that. So by the time it is diagnosed, if you are late, then the morbidity rate is very high. So are we doing anything to sensitize the medical officers in charge across the hospitals to pick up the cases early so that early diagnosis can be made and preventive as well as curative decisions can be taken early so as to prevent the morbidity?
So preventive or prevention is key, as correctly indicated by Honorable Member. And yes, we are now already working hard. I said intersectoral meetings. What is the cause? What are the symptoms? And yes, it is true that training is vital at this point of time. I want to assure the Honourable Member that there is intensive training going on wherever incidence of JE is high. So there is also the other component which needs to be attended to. Activities such as awareness creation, provision of nets, provision of the fogging that is required wherever, especially in the summertime when there is clogging of water, all of that is being done. We are trying our best, don't want to take too much time to highlight some of the technical terminologies, but yes, we are on the job.
Last question, sir. As we could see the data provided during 2023 and 24, the overall diagnosed cases were 89, and 24 and 25 it is 147. So you could see it has almost doubled, despite the statement that has been laid down that various programs, various initiatives, preventive measures have been taken. So where do we attribute the cause of these, high incidences, almost doubling, whether it is a failure of the programs or initiatives we are taking, or whether the programs that we are taking that is not at the optimal level, and what corrective measures can be done so that the number of cases can be reduced?
Honorable Speaker, sir, when you read data, it indicates a few important references. The very fact that today coverage of surveillance is extensive, testing has been increased. So therefore we see that this testing is probably the reason why these numbers are now appearing, and we are now able to attend to this big threat in not just the state of Meghalaya, but several states across India, sir. And hence I want to assure the member, numbers are being indicated because tests are being carried out. Availability of tests, availability of these sentinel centers, availability of the manpower, availability of everything has given us a clear picture and given us a task which needs to be attended to. So we are focused, and yes, we are attending.
Okay. Want to see? Pardon, please.
Sir, may I know from the Honorable Minister, when I look at the numbers given in this reply sheet, the concentration, it seems, and the prevalence is high in areas on the Khasi Jaintia region. And we could see that there are hardly cases in the Garo Hills region. So may I know what is the reason?
Honorable Speaker, sir, numbers indicated are not biased as per communities. We have no intention to say that one area is more infected and the other area is not infected. The Department of Health is combating this disease. No matter where the occurrence is, whether it's in X place or in Y place, we are attending to it. The causes of this disease are also related to farming, related to other practices, and hence I feel that we look at a disease and we ensure that wherever there are these common practices, lifestyles, proximity of animal housing, proximity of, the monsoon season, the increase in temperature, so many factors are there. Let me assure the honorable member, it is not true. Everybody is vulnerable. But if you look at another indicator which I had said, vaccination coverage. Look at vaccination coverage. East Garo Hills, 80%. North Garo Hills, 84%. South Garo Hills, 92%. Southwest Garo Hills, 93%. West Garo Hills, 95%. Look at the coverages in other areas. East Khasi Hills, 71%. You see, Ribhoi, 82%. Vaccination is key to the preventive nature of JE. If you vaccine and you take the vaccination, you protect yourself. We are working hard to break down all the difficult notions that people have, citizens have at large about vaccination. We urge all members of this House to encourage citizens to come forward and take vaccinations for protection.
Sir, it is exactly that what I want to hear from the Minister. Because if I'm made to believe that this disease, the prevalence of this disease in these other districts is not there as shown in this reply, so I want to know. So I would like to thank the Minister for giving a clarification that it seems that in Khasi Jaintia Hills region, the vaccination needs to be improved, needs to be pushed so that the people, the percentage of vaccination will increase. With the increase of the vaccination, I hope that the numbers will be reduced from the numbers that we see today. So am I made to believe, Madam, that whether this disease is not there in West Garo Hills, East Garo Hills, South Garo Hills, as shown in this sheet, in this answer?
You may address the chair, please.
Okay.
Numbers are as indicated in this tablet here, sir, in this table here, sorry, sir. And if the numbers say it is nil, then it has to be nil. But we said, henceforth, we're going to cover the surveillance maximum so that we can ensure. And if there's a number which says nil, that's a good sign for healthcare in the government, in the state of Meghalaya, sir. So, yes, I pray that it will continue to be nil. And I pray that we will be able to continue to address these issues as they come.
Mr. Edward, please.
So, after all, we know the fact that health is wealth. So, another virus, a state of facing, fighting one virus after virus. So, in the course of her reply, during the duration of her reply, we heard she mentioned about surveillance. So may I know from Honorable Minister, is there any surveillance system in place to monitor and respond to future outbreak of GE.
Honorable Speaker, sir, all of the replies that I have given are indicative of a reply to the question put up by the Honorable Member. We are working hard to ensure that GE does not become another deadly virus.
Yes. Khatphra, please.
Thank you, Mr. Speaker, sir. Just one question. May I know from the Honorable Minister in charge of Health and Family Welfare, is there any rehabilitative or follow-up care is being provided to the Japanese encephalitis survivors?
Honorable Speaker, sir, I need clarity because what exactly is the response?
The follow-up for the JE survivors.
GE survivors, sir.
I am not
I
sure.
have no idea, sir. I need to be given clarity on that.
Can you repeat the question again?
No, the patients who have been, affected by this disease. So, like during COVID time, so some people have been affected by the disease, but they survive. So, any, follow-up care for those people who survive.
Honorable Speaker, to set aside any apprehensions of the Honorable Member, I'll be very happy to at least explain the treatment procedure if that is what you require. The treatment of Japanese encephalitis, there is no specific antiviral treatment for JE. The management of the disease is entirely supportive, focusing on managing symptoms and complications to help patient's body fight the infection. So there are few, though these SOPs have not been recommended, but this is the SOP for treatment. First thing, hospitalization. We monitor not just the physical fever, but we look at the neurological symptoms. Then we give them supportive care. We manage fluid. We also have antiemetics for nausea and vomiting and pain control for headache. For the neurological care, so patients with encephalitis require close monitoring for complications like elevated intracranial pressure and seizures. Specific treatments may be administered to manage these issues, sir. As far as post-attack treatments, I'm not aware, sir, because these kinds of questions have not been asked. But yes, when you say that there is a high likelihood of neurological challenges to the patient, if it is required, we have follow-ups of physio treatment for the patients in various hospitals. We recommend other things, and most importantly, diets of the affected patients.
So, thank you, ma'am. So, just one question more. What are the main symptoms of this GE, madam?
Signs and symptoms of JE. It is a viral disease transmitted to humans by the bite of infected mosquitoes. Majority of people infected with JE virus do not develop symptoms or have very mild flu-like symptoms. However, a small percentage of people can develop a severe life-threatening form of the disease that affects the brain. The incubation period, which is the time from infection to the onset of symptoms, is typically 5 to 15 days. The signs and symptoms are as follows. mild or asymptomatic cases. Most people, about 99% of these who are infected by JE, will not show any symptoms. If symptoms do not appear, they are usually mild and may include fever and headache. In severe cases, in about 1 in every 250 people, the infection progresses to encephalitis, inflammation of the brain, which is a serious condition. Symptoms of severe JE include initial symptoms, high fever, severe headache, vomiting. Neurological symptoms that may develop over a few days: stiffness of the neck, disorientation and confusion, weak and paralysis, tremors, seizures, change in behavior or mental status, sometimes even coma. I repeat, 1 out of every 250 who are infected by JE may come to this stage of seriousness. The vulnerable age groups, we have said, it is young children, and as the mover of this question herself said, older adults. And like I said, the key to this is preventive care, which is vaccination.
Habatin, pej bahagi kishab plus F.
Ka plus F?
Hakabam bangibam dunaki eki batay kamet. Namar kata habathiru atau khau kamlu ka umpnyang kadut pej ya kishab plus F hakajingsom. Yaki nutrient kumki vitamin bat ka iron la icon diat bat akabatau bha kam kata ikadur jengki marbam kajing mat lani ka rukom shed yaki.
Balehi banai kita.
Kadon ka we kajing mentoy bakongsan. Ka kot ka kia. Ka nutrition bakam bha kajing im bakam bha pendon kam daki marba madon ka sharp plus F menta kasni.
Lawan Ra Shafi Lingba ko office jong Commissionerate of Food Safety Meghalaya.